Hi there, it's Dr. Ghag here. Today I want to take the chance to talk about PMS and why you may be experiencing certain symptoms. So PMS, or premenstrual symptoms, are symptoms that you may experience right before your menstrual cycle or your period, and it may be a couple of days before or a week before, and the symptoms can actually occur for the first couple of days as well. So symptoms vary from woman to woman, but some common ones include headaches, acne, back pain, abdominal cramping, and food cravings, which I'm sure we've all been a victim to at least once. So some women have actually been experiencing these sorts of symptoms since their very first period, so they expect that it's a normal part of their cycle. But guess what? It's not, and it doesn't have to be. So these symptoms are actually occurring because of a hormone imbalance going on. So your hormones are going for a little bit of a joyride and unfortunately taking you along with them, which is causing you to probably suffer a little bit along the way. So let's see what's actually going on here. So in the first half of your cycle, estrogen levels naturally increase, and along with the increase, you may feel an increase in your mood as estrogen promotes serotonin and dopamine production. So you feel happy and you feel motivated. In the second half of your cycle, estrogen levels continue to increase, but what happens if your levels get too high? Unfortunately, that doesn't mean more motivation, but because estrogen is a stimulating hormone, you may experience symptoms such as headaches, irritability, diarrhea, and breast tenderness. Also, the natural decrease of estrogen that occurs near the end of your cycle may produce certain symptoms as well, or withdrawal symptoms such as fatigue and night sweats. This is where progesterone comes in. So progesterone naturally increases during the second half of your cycle, or the luteal phase, and it promotes a sense of calmness, also increases your mood, and promotes sleep as well. So if your progesterone levels are too low, or if they fall too quickly, you may experience symptoms such as anxiety, but also all the additional symptoms you would experience with estrogen dominance or estrogen withdrawal, as progesterone is not there to protect you from that. So what can you do about your symptoms? So number one, decrease inflammation. Systemic inflammation, or inflammation in your body, has been shown to interfere with the natural communication between your hormones. So by decreasing inflammation, you can allow your hormones to function properly. This can be done so through diet, either through an anti-inflammatory diet or by implementing certain herbs and supplements such as fish oils, turmeric, and boswellia to kind of bring that inflammation back down. Number two, boost progesterone. By increasing your progesterone levels, if they are low, you can continue to balance out and protect you against the effects of estrogen and decrease all those PMS symptoms that you've been experiencing. So this can be done through hormone restoration therapy and also certain herbs and supplements as well. Last but not least, number three, you want to make sure that your estrogen is being metabolized properly. High levels of estrogen can be found in the body if your body is producing too much estrogen, or if your liver is not functioning optimally to help metabolize that estrogen and get rid of that excess estrogen. So along with supporting estrogen metabolism, by eating certain vegetables such as broccoli, you also want to support the liver's detox pathways with certain things such as dandelion, milk thistle, and IV glutathione actually works really well for that as well. If you're experiencing any PMS symptoms, it's important to know that that can be changed. It's not normal to have an uncomfortable period, but instead it's normal to have a happy, smooth, painless period. If you're curious on how natural remedies can help you bring you back to your optimal health, then please book a free 15-minute consultation to find out.